The National Institute for Communicable Diseases says respiratory syncytial virus is on the rise in young children. The body says RSV has been detected in 19% of children aged 5 years or younger who have been hospitalized with lower respiratory tract infections. So for more on what parents and caregivers should be looking out for, let's talk to the NICD's Public Health Response Head. That's Dr. Michelle Groome, who joins us via our video link this morning. Dr. Groome, great to have you with us on the program. As always, how serious is RSV?
The RSV has been around for a number of years, and even prior to COVID, we used to always have an RSV season, which usually used to start kind of around February, March, and was really used to fill up the hospitals. So it's really a disease of younger children. So usually children under 1 year of age usually get the most severe disease. And for the most part, most children won't actually get severe disease. They could be safely managed at home. But in a small proportion of children, it can lead to hospitalization. And so at the moment, there's no vaccine available for RSV. And so we would really be managing it symptomatically and watching for severe symptoms. And so what we've seen really, the warning came about is over the past 2 years, obviously we've had several lockdowns, we've had restrictions in place in terms of, gathering and social distancing. And while that's decreased COVID, it has also decreased other respiratory viruses. And now with the opening up of the economy and lessening of restrictions, I think we are seeing these other respiratory viruses that haven't really been circulating over the past 2 years kind of coming back. And so at the NICD, we started seeing an increase in cases this year in RSV. So we usually monitor children under 5 years of age, and we have what we call sentinel surveillance. So this means we monitor some hospitals, not all hospitals in the country, but there's some hospitals that we're monitoring. And so those percentages that you're talking about is really coming from our sentinel surveillance. And that really gives us an indication of what's happening at a national level. And so we started seeing these increasing cases now kind of mid-February, and we're just worried that, we would have a larger season than we've seen in the past 2 years. And so we did see this rising number of cases. It has, in fact, started to come down slightly over the last 2 weeks, but really important that caregivers, especially in younger children, do watch out for respiratory symptoms and for RSV. So usually how it presents is as with any other respiratory virus. Children may present with fever, cough. Also, especially in the younger children, they may not be drinking, their bottle or breastfeeding as well. And so I think the symptoms really to look out for is if your child looks like they're struggling to breathe. So it looks like they may be breathing very fast. Sometimes with small babies, if you have a look at their chest, you can actually see the little areas between the ribs get drawn in. And these are really signs that you need to take your child to see a health professional, and so that they can assess them. And as I say, a small proportion of children may need hospitalization.
Sure. It sounds incredibly worrying indeed. And I'm just looking at some of the information that the NICD has sent us as well, insofar as those sentinel surveillance sites is concerned. So, Dr. Groome, when you say that RSV detection among children under 5 in pneumonia surveillance rose above the seasonal threshold, what does that mean? It's more than you would have expected for this time of year?
No, so we usually have these thresholds when we kind of say, for most of the respiratory viruses. So there's a certain threshold, and usually that's the detection rate. And that's very similar to the COVID positivity rate. So we're monitoring, and remember, these are hospitalized children. So when children in our sentinel hospitals are admitted, they'll do a respiratory swab. And then they would send it for actually a number of viruses. And so if it comes back positive, and say there were 100 children and 18 of those were positive, that would be an 18% detection rate.
Oh, I see.
And so that's what we're monitoring. And so there's certain thresholds. So when it moves beyond a certain percent, we say that we've actually entered the RSV season. And there's similar thresholds for the flu season as well. And so that really just means it's not unexpected. I mean, we are expecting, RSV has always been a seasonal disease. We actually, before COVID, we're always expecting there to be an RSV season. And so that threshold is really just above when we can actually say, look, the cases have gone above the baseline. So we see these cases all through the year, but there's certain times of the year, usually autumn period, where we see increased number of cases. I
mean, the bottom line, Dr. Groome, from what you're saying is it can be very serious. Children in RSV that have RSV may well need hospitalization. They may well need supplemental oxygen as well.
Yes.
As a parent who's watching this morning and whose child may be presenting with these kinds of symptoms, is it something I can be treating at home?
Yeah, so I think if it's mild symptoms, I think you can really, if it's fever, you can give your baby something like paracetamol to contain the fever. Make sure that they're staying well hydrated, that they may not feel like eating in older children, but it's really important that they are getting in enough fluids. The high-risk babies are usually babies under 6 months of age and babies that were born prematurely or maybe have some sort of underlying kind of immunodeficiency. And so those are the children you really need to watch out for. So I think initially many of these can be managed at home. And as I say, just to watch out for the worrying respiratory symptoms or fevers that you're not able to bring down with paracetamol and those kind of signs of respiratory distress that we've mentioned. So just to remember that young children can often deteriorate quite quickly. And so if the babies, especially if they're not drinking adequately, if they seem to be breathing fast, I think you need to take them through to your doctor or through to a hospital for assessment.
Absolutely. Better safe than sorry. Dr. Groome, in the treatment of RSV, we've talked about supplemental oxygen for one, but is it a virus that's treated with antibiotics?
No, so that's also very important. Thanks for raising that. So it is a viral infection. So prophylactic antibiotics are not recommended. So that means, once the symptoms start, you shouldn't be treating this with antibiotics as it's a viral infection. As with many viruses, it is possible that, a few days later, there may be a bacterial infection that could occur on top of the viral infection. But in those initial few days, antibiotics really do not assist in managing and really are quite shouldn't be used in terms of increasing antibiotic resistance. So I think this really is just symptomatically managed even in hospital. They usually would give supplemental oxygen. There is a monoclonal antibody, which is a type of drug that can be used, but this is quite expensive. You need to give it regularly, and so it's not often used. But this may be something your doctor may consider.
Some great advice there. Dr. Michelle Groome, as always, thanks so much for your time. The head of the Division of Public Health Surveillance and Response at the NICD, joining us this morning, talking about an uptick in incidents of RSV, particularly in children under the age of 5. Dr. Groome, thanks very much indeed.